If you're living with diabetes, I want you to think about your feet for just a second. Foot care, it's not a luxury, right? It's not about getting a pedicure. It's an absolutely critical daily practice to prevent some really serious health problems. We're talking about issues as serious as amputation. So let's dive in, because it turns out just a few minutes a day can literally make a lifetime of difference.
All right, here's what we've got on tap. First, we're going to look at some pretty shocking facts about what's really a preventable crisis. Then, we'll get into the how, like how does diabetes actually affect your feet? From there, it's all about action, your daily routine, why your shoes are a huge deal, and finally, knowing when it's time to call in the professionals.
Okay, let's just rip the Band-Aid off and get a handle on the scale of this problem. The numbers, well, they're pretty staggering. But, and this is the important part, they also show us just how much we can do to prevent the worst from happening.
Take a look at this number, 4,400. Just let that sink in for a moment. In Australia alone, that's how many amputations happen every single year as a direct result of diabetes. I mean, that's just a devastating figure.
And the cost? It's not just personal, it's massive. We're talking about $875 million a year that diabetic foot disease costs the Australian health system. But look, this isn't just about throwing big numbers at you. This is about understanding why this happens so we can stop it. So when you hear those numbers, you have to ask what's actually going on here to cause all this. Let's pull back the curtain and look at the why. It turns out high blood sugar can be a silent troublemaker, creating what's really a perfect storm for your feet.
It often starts with something called diabetic neuropathy. The best way to think about it is like this. Your foot's built-in alarm system gets switched off. You know, that system that tells you, ouch, I just stepped on something sharp. Well, over time, high blood sugar can damage those nerves, which means you might not be able to feel pain or even heat and cold in your feet at all.
And that is where things get really dangerous. I mean, think about it. If you can't feel pain, you might not have a clue that you've got a small cut or a blister from a shoe that's rubbing. And that tiny, totally treatable issue, it can go completely unnoticed and turn into a serious open wound, or what doctors call an ulcer. So it becomes this really dangerous 1-2 punch. First, the nerve damage, that neuropathy means you don't even know you're hurt. But then there's a second problem, poor circulation. Diabetes can also affect your blood flow, meaning your body struggles to get enough blood down there to heal that very same injury. You can't feel it, and you can't heal it. That combination is a perfect recipe for a nasty infection. But after all that doom and gloom, here is the good news. And honestly, this might be the most important thing you hear today. Up to 85%, let me say that again, 85% of these amputations are preventable. This is not some inevitable outcome. It means that with the right care and a little bit of attention, you have the power to protect your feet. All right, so if prevention is the name of the game, how do you play? Let's get super practical. We're going to walk through a simple daily routine. Think of it as your 5-minute toolkit. This is your absolute best defense. Step 1, wash your feet every day. The key here is warm water, not hot. It's a good idea to test it with your elbow first, because if you have nerve damage, you might not be able to tell if it's scalding. And you don't need to soak for ages. That can actually dry your skin out. A quick, gentle wash is all you need. Step 2, dry them off. And I mean really dry them, but be gentle. The #1 spot people miss, right between the toes. You have to pay special attention there because any trapped moisture is like a welcome mat for fungal infections, and we definitely don't want that. Step 3 is to moisturize. Keeping that skin soft and supple helps prevent cracks. So grab a good lotion and work it into the tops and bottoms of your feet. But, and you're probably sensing a theme here, do not put any lotion between your toes. Same reason as before, we want to keep that area nice and dry. And now for what is, without a doubt, the most critical step of all. Step 4, you have to look at your feet every single day. Check the tops, the bottoms, the sides, and yes, between the toes. If you can't see the bottom of your feet easily, just use a mirror on the floor. You're basically a detective, looking for any clues. Cuts, blisters, redness, swelling, anything that looks different. Catching things early is the whole ballgame. Okay, so on top of that 4-step routine, here are a few other essential habits. When you trim your toenails, always go straight across. This helps prevent ingrown toenails. Also, and this is a big one, never, ever walk barefoot, not even in your own house. And before you slip on your shoes, give them a quick shake and feel inside for any little pebbles or rough spots.
Throughout the day, wiggle your toes, circle your ankles, keep that blood moving. And finally, if you smoke, quitting is one of the best things you can possibly do for the circulation in your feet. All right, let's switch gears and talk about armor. Yep, armor for your feet. Because your shoes and socks are your first line of defense against the outside world. So choosing the right ones is a really big deal. So what should you be looking for when you go shoe shopping? Here's a quick checklist. First, you need wiggle room for your toes. That means a nice, deep, wide toe box. Next, feel the inside lining. You want it to be as seamless as possible, because even a little seam can rub you the wrong way. Third, check the soles for good shock absorption. Fourth, a stable heel is great for balance. And finally, look for something adjustable, like laces or straps, because feet can swell during the day and you need to be able to adjust that fit. And hey, don't forget the socks. They're just as important. You want to go for soft, seamless options to cut down on any irritation. And here's a pro tip. Avoid socks with really tight elastic bands at the top. You don't want anything digging into your leg and messing with your circulation. So, your daily routine is the foundation. It's what you do day in and day out. But the great thing is, you don't have to do it all alone. You have a team. And your doctor, and especially a podiatrist, are key players on that team. You know how you're supposed to get a comprehensive foot exam at least once a year? Well, what does that actually involve? Let's demystify the process so you know exactly what to expect. Well, a provider will start with just a visual check. Then they'll often use a soft little nylon fiber, it's called a monofilament, to test for sensation at different points on your foot. It's a key test for neuropathy. They'll also check the pulses in your feet to assess your blood flow and might even use things like a tuning fork to check nerve function. It's all pretty quick and painless. Now, outside of your annual checkup, there are some red flags that mean you need to call your doctor right away. No waiting around. If you've got a cut or blister that just isn't healing, that's a red flag. Any skin that gets red, warm, or painful, red flag. A callus with what looks like dried blood inside, or, and this is serious, any infection that turns black or has a bad odor, don't hesitate. Make the call. And this really brings it all together. The key to keeping your feet healthy is that partnership, right? It's you doing your daily self-care, and it's your podiatrist providing that regular professional care. That combination is the absolute gold standard for both preventing problems and healing them quickly if they do pop up. So here's the thought I want to leave you with. Your feet are your foundation. They carry you through your entire life. And we've just seen how 5 little minutes of attention each day can prevent the most serious complications of diabetes. The only real question is, what are you going to do with your 5 minutes tomorrow?